How do you master differential diagnosis for USMLE Step to CK? Imagine you're in a busy emergency room and a patient walks in with chest pain, shortness of breath, and sweating. How do you quickly figure out what's really going on? That's what mastering differential diagnosis is all about. It's a key skill for the United States Medical Licensing Examination, Step 2 clinical knowledge, and 4 passing the clinical skills part. First, you need a solid foundation of clinical knowledge. Study common diseases, their typical signs, symptoms, and the tests used to confirm them. Use question banks like UWorld, which mimic real exam questions with clinical vignettes. These help you recognize patterns and understand what clues point to each diagnosis. Next, organize your thinking with structured frameworks or mnemonics. For example, the poem's approach helps you consider pulmonary, gastrointestinal, endocrine, metabolic, and psychiatric causes. Categorizing symptoms by organ system or disease type keeps your mind from missing less obvious options. Practice is essential. Do timed practice questions that mimic the exam setting. Analyze each answer choice carefully. Why is this diagnosis correct or incorrect? This sharpens your clinical reasoning and helps you prioritize the most likely causes based on patient history, physical exam, and initial labs. Focus on common presentations. Many exam questions revolve around frequent conditions like pneumonia, myocardial infarction, or urinary tract infections. Memorize their key features and diagnostic criteria. This targeted focus saves time and aligns your study with what the exam emphasizes. Create a personal golden notebook or master document. Summarize differential diagnoses, key clinical features, and diagnostic steps. Use flowcharts or tables to compare diseases with similar symptoms. This quick reference helps reinforce your memory and makes review easier. Understanding management principles is also important. Know how to approach diagnosis through appropriate tests and initial treatments. This helps you see the bigger picture and choose the best answer when questions involve patient management. Simulate exam conditions regularly. Take full-length practice tests under timed settings. This builds stamina and helps you develop pacing strategies so you can carefully consider each differential without rushing. Finally, challenge yourself with complex or atypical cases. Use flashcards or notes to review these scenarios often. This prepares you for tricky questions that test your ability to think outside the box. By combining solid knowledge, organized reasoning, regular practice, and time management, you can master differential diagnosis for the USMLE Step to clinical knowledge. This not only boosts your exam score but also sharpens your clinical decision-making skills for real patient care.